key references for kind of the costs and benefits of green buildings had come from Greg Katz, who's a key consultant and author who's focused a lot on the relationship of buildings and energy performance, but there's also other aspects to this. And he did a study that has been well cited in prior years in 2003 called The Cost and Financial Benefits of Green Buildings. He ended up updating that study, turning it into a book called Greening Our Built World, which was published in 2009. Actually, the purpose of developing this book was originally to update and expand the data set of his original study of green buildings, and at the time there were only 33 LEED certified buildings in the world. So you can imagine how many more became available for research as time went on. And in fact, 2 or 3 dozen of the projects that he studied for the updated issue were projects that my company had consulted on. We provided some of the data, what we knew about the building costs, the building performance, et cetera. So one of the ways of looking then at the benefits is looking at benefits over time. And so one way to look at it is to compare the dollar for dollar benefit over a certain period of time, and usually 20 years is looked at as the length of time, compared to the dollar invested up front in improving the design, improving the systems in terms of energy efficiency and all the other attributes of green buildings. So for each dollar initially invested in the first cost, it's found that reduced health care costs can lead to a net present value, 20-year value of $2 in savings. Specifically reduced respiratory infections, allergies, and asthma for green buildings, i.e. healthy buildings, would be $1 savings. But then the productivity increases from an improved work environment. This was specifically focused on workplaces as opposed to residences, can be $13, okay, for every $1 invested in the first cost. And productivity increases from reduced sick building syndrome, I'm going to talk about that a little bit later when we get into indoor air quality, have actually been found to range from $12 to $35 in savings, okay? So those are the kinds of numbers that we're looking at that have been studied and developed over the years in terms of what are the tangible financial benefits. There are a number of different healthy building programs out there. Certainly there are a greater number of general green building programs, but I'm talking specifically about the concept of healthy buildings today. So one of the things that I had researched over the years included this concept of healthy workplace programs. So that terminology, healthy workplace, is really a global one. And I found that the concept of healthy workplace has relationships to the built structures and the built environment of the workplace, but it also has other aspects in terms of community, in terms of anti-harassment, anti-bullying policies. So these are some very interesting, multifaceted national and international policies that can be looked at. So Canada has been one of the leaders with the Canadian Healthy Workplace Criteria. In this talk, I'm not going to drill down into all of that because I'm focusing on those things that have to do with the building side. But it is fascinating stuff. In the United Kingdom, they have a strategy which becomes national policy of health, work, and well-being. And the UK in particular emphasizes the point that while it's extremely important to be concerned about the health and well-being of children and seniors, it's also extremely important to not neglect those of us of working age. So that entire spectrum of the population that is working needs to have their workplace addressed in terms of public health. So there's all these different programs with all their different criteria and different aspects that they emphasize, but they all kind of have the same intended results, even between office building focused ones and residentially focused ones. They're all looking at promoting physical and psychological health and well-being, which leads to improvements in productivity and human performance. And by the way, how you measure human performance depends on the kind of or the kind of environment that you're in. If you're looking at what is the productivity and human performance element in a retail establishment, you can measure that by the dollars of sales. If you're looking for what is productivity in a factory, it may be, number of widgets manufactured. If you're looking at productivity in a school, you might be measuring test scores, because the activity in a school is supposed to be learning, and so test scores are one measure of the learning. And in the healthcare environment, you're looking at the rate of healing, and you're looking at the rate of avoided infection, because infection control is as important in a healthcare environment as the actual healing. But looking at the first topic area, which has to do with lighting and the relationship of light and human health, some of us have these direct experiences with the relationship of light, and then others may be surprising. Light can alleviate seasonal depression or seasonal affective disorder. That's why one of the cures for that is a light box next to you. It can increase the length and quality of sleep, so the quality of light you get in the day and the absence of light that you get at night. It can improve performance, if it's done correctly, of workers who perform their tasks in the night shift. It can improve weight gain in premature infants. Who would have thought about that? It regulates melatonin in our systems, which has also been shown to reduce breast cancer growth. And it has a direct impact on cortical brain activity. So light is something that we need to make the most of. It's available to us. We were fortunate to have plenty of it when all the electricity went out. So we need to respect it and use it. The relationship specifically to productivity has many attributes as well, many facets. It leads to better individual task performance, which makes sense. People who are more satisfied with their lighting tend in surveys to rate their spaces as more attractive visually. So if it's not well lit, it might not look nice. And people want their workspaces and their environments to be nice. Dimming controls, which is one aspect of occupant control, gives people more motivation and improves their performance when measured in terms of retention, in terms of workplace tasks. These are all studies that were done by the Lighting Research Center. Shading studies can show you how external, or in some cases internal, shading devices can contribute to an effective daylight strategy. When you're, of course, blocking out light that's coming in as glare, that's what you want to block out, but perhaps integrating it with light shelves to bounce the light into a more generally ambient lighting environment. Acoustics. This was the graph that I was mentioning earlier, where you can really see the dissatisfaction of the acoustics in office environments. So over here we're looking at satisfaction rates of people in private offices. The yellow is the measure of satisfaction with the noise level, the general ambient noise level, and the gray is level of satisfaction with sound privacy. Privacy is a concern in pretty much any building that involves people. So private offices, pretty satisfied. Shared offices, okay with the noise level, but there still lacks privacy because you don't have anything blocking speech from the other occupants in the shared office. Really not satisfied with the high partition cubicle, low partition cubicle, ain't much better. And open office as well. This is all pretty much dissatisfaction in terms of acoustical attributes. So this study, which was from, I believe, 2005, found that over 50% of occupants of cubicles were not satisfied with the acoustics of their environment. And not only that, but they felt that it got in the way of them getting their work done. So we really do have to pay attention to this particular healthy building attribute, because there is a direct correlation with the ability to perform tasks.